So today for our Good Health and Wellness Community Health webinar series, we have Camilla Barajas as our presenter today with the Winnebago Diabetes Prevention Program. Camilla is the Diabetes Program Director at the Winnebago Public Health Department. So I'm going to go ahead and pass it over to Camilla. Thank you for being with us today.
Thank you. Hello, everyone. I apologize in advance if I'm looking in different directions because I do have 3 different screens up. So by the end of the presentation today, you'll gain a better understanding of prediabetes. You'll learn more about the National Diabetes Prevention Program. You'll learn more about the Winnebago Diabetes Prevention Program. And I'll try to answer this question for you. How do we maintain CDC recognition status for our diabetes program? And I chose that question because that's the question I asked myself during the pandemic. How do we maintain recognition status? I did panic a little, but we did make it through, and I'll share more about that later in the presentation. So what is prediabetes? I'm using plain language. This is language straight from the Prevent T2 curriculum. We try not to use too many medical terms and want to keep things as simple as possible. Prediabetes means that your blood sugar is higher than normal, but not high enough for type 2 diabetes. If you have prediabetes, you are more likely to get diabetes, heart disease, or stroke. Over 80 million American adults have prediabetes, or 1 in 3 adults. 9 out of 10 people with prediabetes don't know they have it. Without lifestyle changes, people with prediabetes could develop type 2 diabetes within 5 years or sooner. And the reason this is so important to us here in Winnebago is the prevalence of diagnosed diabetes is highest among American Indians and Alaska Natives. So you're more at risk for prediabetes if you are overweight, which is determined by body mass index. Your provider will let you know if you fall in that category. And I always tell my participants and patients, don't let that number bother you. It's just a number. Once we know our numbers and parameters, then we just work on ways to bring that number back to normal range. You're also more at risk if you have a parent or sibling with type 2 diabetes, if you spend a lot of time sitting or lying down, if you are African American, Hispanic, Native American, or of Asian descent. If you are 45 years or older, you're more at risk, and you're also more at risk if you have had diabetes while pregnant, and that's also known as gestational diabetes. So there's many risk factors. So we just heard a lot of not so great news, and here's the good news. Prediabetes is reversible. That is what diabetes prevention is all about, catching people while they can make these healthy changes and decrease risk. So the National Diabetes Prevention Program, also known as DPP, stems from the results acquired from the research study and follow-up in 2002. In 2010, Congress authorized the National Diabetes Prevention Program due to the strong evidence it supplied. The results showed that this structured lifestyle program reduced the risk for developing type 2 diabetes by 58% in adults at risk. The key goals of the program are to decrease body weight by 5 to 7% and increase physical activity minutes to at least 150 minutes per week. So to be eligible to enroll in the diabetes prevention program, you must be at least 18 years or older, must have a body mass index of 25 or greater. And remember from the previous slide, that's just a number. The goal of the program is to decrease that number. Participants have to have a prediabetes diagnosis confirmed by lab or a prediabetes risk score of 5 or greater. They cannot have a diagnosis of type 1 or type 2 diabetes, and participants cannot be pregnant at time of enrollment. Let's see. Okay, so to become a CDC recognized program, you must use a CDC approved curriculum. Your staff will need to go through training through either the CDC or Association of Certified Diabetes Care and Education Specialists to become a certified lifestyle coach. You'll be required to track and submit data every 6 months, and you must deliver classes following the Centers for Disease Control and Prevention, Diabetes Prevention Recognition Program Standards and Operating Procedures Manual, also known as CDC DPRP Manual. You can see why we use a lot of acronyms. Okay, so why is CDC recognition important? To ensure quality and adherence to proven standards, to unite all diabetes programs under one national framework, to increase coverage by employers and public and private insurers. In addition, it is evidence-based and proven to be effective. And that means a lot to us to be able to tell our community members these things. Once you become a recognized program, you're listed on a national registry on the National DPP website. Currently, there are 2,205 recognized programs in the United States. And in the state of Nebraska, Winnebago is one of 2 tribal programs recognized by the CDC. We are proud to be listed on this registry. The Winnebago tribe in Nebraska is located in the northeast corner of Nebraska. Total enrollment as of 2017 was 5,277, with 1,744 tribal members living in Winnebago and 495 tribal members living in Sioux City. Sioux City is just a 30-minute commute from Winnebago. The name of the Winnebago DPP program is Ho Chunk Hope. We applied for CDC recognition in 2017 and gained preliminary recognition in 2018. We have 3 certified coaches, and our program offers 16 weekly classes. We then transition to bi-weekly classes and then monthly classes, and the program runs for a full year. In 2019, the Great Plains Good Health and Wellness Program, in partnership with the Pine Ridge SDPI program, created a culturally adapted Prevent T2 curriculum. We received permission to use this curriculum right away in 2019 and continue to utilize it today. We found that it really matters. The pictures are more like community members and the stories make sense because they're about activities we understand. Food is a powerful tool we utilize in our program. Everyone struggles with healthy eating and how to make recipes healthy. We never want to shame people for eating the wrong type of foods. And our freezer meal workshops are designed to teach participants how to use healthy ingredients in their recipes. A healthy meal is prepared for each class so participants can try healthy ingredients they never tried and learn how powerful it is to replace one ingredient. We never want our participants to be scared of food because food really is medicine. It's important to mention the coronavirus. This was a big part of our lives and still is. We're not completely in the clear yet. This did affect our programming significantly. As you all remember, in December 2019, the coronavirus was identified as the cause of a disease outbreak in China, known as the COVID-19. In March of 2020, the World Health Organization declared the COVID-19 outbreak as a pandemic. In March 2020, the Tribal Council declared the COVID-19 pandemic a public health emergency, authorizing actions to protect the community. Some protocols were put in place, such as temporary curfew order, a mask mandate, a hold was put on all travel for employees. Staff alternated between on-site and telework schedules to decrease the number of people in spaces. Classes halted and the gym closed. So this is where that question came up. How do we maintain CDC recognition status for our diabetes prevention program? I started to look at our strengths and challenges. We have skilled staff with a diverse skill set. We have good community support, collaborative health efforts by all entities with various task force and committees. We have a close connection between the health department and the hospital, which comprises the compacted healthcare system, known as the Winnebago Comprehensive Healthcare System. Our challenges at hand was the pandemic. This made it hard to retain participants, and it was difficult to meet weight loss goals with decreased physical activity and gym closure. It was hard to work through the fears and keep the momentum going. Healthy eating was a challenge, and we could not have our freezer meal workshops, which was a big hit. We learned how resilient we were for sure. We had to get our creative hats on and march forward. The fitness staff provided exercise videos online for participants to try at home. Our nurses took on case management caseloads and called participants to decrease fears and keep them updated with the latest CDC guidance to stay safe. Our nutrition specialist could no longer do freezer meal workshops, but she provided online videos to show participants how to make healthy dishes at home. The public health programs collaborated to provide drive-up meals for community seniors and children. Everyone pulled together. So in review of our program, we had to maintain at least 5 eligible participants for the full year. We met this goal every year. And if you look at 2021, that is the evaluation of the pandemic data. As you can see, we barely made it, but we were able to maintain those 5 participants through the whole year. This slide shows the retention of our participants for the first 6 months. We met this goal every year as well. And surprisingly, during the pandemic, there was more engagement. This slide shows the retention of participants for the second 6 months. We met this goal every year as well. And again, during the pandemic, we've seen more engagement. This slide shows the weight loss requirement. The cohort as a whole must lose at least 5% of starting weight. We did meet this measure in 2019, but the other years we struggled with this. This is the one measure preventing us from gaining full recognition, but thankfully, by meeting all the other measures, we're able to maintain preliminary recognition. I also want to point out the 2021 data revealed 0 weight loss. This was the pandemic cohort, and we still celebrated because they did not gain weight. they were able to maintain their weight during the pandemic. And that's a win in my book. Through all the challenges, they were able to maintain their weight. So back to our question, how do we maintain CDC recognition status for our diabetes prevention program? Mainly through teamwork. It takes an entire community. The team includes lifestyle coaches, nurses, public health programs, tribal programs, hospital staff, family members. The list is endless, but it definitely takes a team. Collaboration is key. Working together helps to maximize resources. Creative thinking, change things up a bit, utilize workout videos, healthy food videos, make classes fun. It also takes a lot of encouragement, not just for participants, but staff as well. We can rely on each other to keep momentum going and to stay positive. It can get really lonely and difficult when you see participation numbers drop or you see the momentum drop. It's okay to ask for help. We have team huddles every week, so we can lean on each other and reach out for help if we need it and work on issues together. At this time, I want to say thank you for listening. That's the end of my presentation, and I'll leave it open for questions if you have any questions.
Thank you, Camilla. That was great. And I just want to say congratulations on being able to maintain your recognition. I know getting CDC recognition takes a lot of hard work, and I'm amazed that you guys have been able to keep going through the years. So congratulations on that. And it's great to hear that.
Thank you.
And yes, like Camilla said, it's now open for questions. I am, before questions get started, going to put a link to an evaluation form in the chat. Just before you hop off the call today, we would really appreciate if you just took a quick minute to fill that out. We appreciate everyone's feedback. And I'm not seeing any questions just yet, but I was curious, Camilla, when you mentioned the different kind of levels of recognition, as you mentioned, you're in preliminary right now. Is there a difference? I mean, what would you gain exactly for being fully recognized versus preliminary? And what exactly would happen if you didn't meet all your criteria and got bumped down from preliminary? Can you kind of explain those different levels for that?
Yes, so with preliminary recognition, we can still bill if we want to. We could still, we're still a recognized program, so we can bill. With full recognition, you don't have to, you maintain that status a little more easily. With preliminary, if we do not maintain the guidelines in the 6-month time period, we could lose recognition altogether. So we have to work really hard to maintain our data and make sure we're meeting all these benchmarks and the guidelines to stay in preliminary. So it really is kind of difficult to stay in the preliminary status. Hopefully we can make it to full recognition soon, then we don't have to stress as much.
Right, yeah. And if you end up for say lose recognition, are you allowed to kind of reapply, or what happens if that is the case?
If we did lose preliminary recognition, we could reapply. And so that would mean the first year we would be pending. Once they evaluate the data after the first year, then we could gain preliminary again if we met all criteria.
Got it. Yeah, like I mentioned, it's a lot of
starting all over.
Yeah. Well, with that, do you have any tips for any programs that are just starting out and maybe want to apply and kind of get pending recognition? I mean, how do you start with that? Did you use the CDC's program assessment beforehand? And did you get all your lifestyle coaches trained ahead of time? Kind of what was your layout for getting started?
Yes, we did. We actually applied for a small grant. We did get a grant through Good Health and Wellness. So we could meet some benchmarks. We had to get staff trained and make sure that we had a good solid team before we applied. And I think that's the key. Kind of look at your team and see who could be trained for lifestyle coaching, because the lifestyle coach is going to really be the leader in facilitating classes and making sure the data is complete. And you also need a good data person, somebody who can keep track of that data and submit the data. That can get pretty tedious and time consuming. So we had 3 team members when we first started, really dedicated to our DPP program. One was myself, the lifestyle coach, and then we had our program director at the time was the data person. He was the one tracking data and submitting the data. And then a outreach person to do the recruiting. We do a lot of our recruiting through our community screenings, and we find participants that way. But also through the pandemic, we could not do community screenings, and that kind of got in the way for us. But I've seen in training, a lifestyle coach trained, and they were going to run the whole program by themselves. It was a one-man program.
Wow.
And people do that, and maybe they're successful, but I think it's better to have a team. And also the public health department is behind us, so we have other programs that can step in and help us, and we can all work together and maximize resources and do more fun things that way.
Absolutely. I do have a question in the Q&A. When you say you're able to bill, does that mean bill to the CDC and receive money for each participant?
Yes, we're currently not billing for our program, but that is a quality that they mention. We do want to work towards billing sometime in the future, and you would bill the participants and it would generate revenue for your program.
Thank you.
Right now we're grant funded, so we're not working on the billing, but I mean, that would be another way to generate revenue for your program.
Awesome. Well, I don't see any other questions coming in. So again, we'll be sending out this recording afterwards to everyone who's registered. So if you do have questions later on, please feel free to reach out to me and I can put you in contact with Camilla for any questions. Otherwise, I think I'm glitching. My computer's being slow here. Stop recording, see if that helps.